The most specialist of all medical procedures, a post-mortem.
The term post-mortem translates from Latin to after death. Post-mortem care more closely pertains to the care of a deceased body, inclusive of the preparation and documentation of the body, as well as the provision of support to families before transport to a funeral provider or alternate medical provider.
Remove the pillow, close the mouth. To support the jaw, place a pillow or rolled up towel underneath the chin. Gently close the patient's eyes if they are still open for 30 seconds. Drain the full bladder by pressing on the patient's lower abdomen and collect urine in a bedpan.
Place a cotton pad or absorbent pad.
Any wounds should be covered with a clean absorbent waterproof dressing. Wash the patient unless requested not to do so, for religious reasons or preference. When moving patient, act be released or sometimes confused with breathing. Dress the patient in personal clothing or white garment. Remove all the jewelry, should be secured with a tape.
Place a clean sheet underneath.
Ensure that the correct hospital patient identification label is attached to the patient and attach further label to the patient ankle. Wrap the patient's body from feet upwards, tightly wrap the body in the bottom sheet.
Note: ensuring that the face and feet are covered and all limbs are held securely in position.
Complete any documentation such as notification for death cards. Prepare materials, hot water, gloves, hot water bag with stopper, towel, waterproof pad. Provide privacy by closing the door, window, or curtain. Greet and introduce yourself to the patient and explain the procedure.
I'll be your student nurse for today. May I know your name?
Sarah Guevara,
May I know your age?
19,
May I know your birthday?
Feb 22, 2003.
May I check your wristband? I will do hot compress. Is that okay with you?
Perform hand hygiene. Wear gloves to prevent the transfer of any microorganisms that might be present on the patient. Drape the patient and expose only the part that will be treated. Proceed in applying the hot compress by putting first the waterproof pad below the body part of the patient that is being treated.
Take note of the water temperature.
Since the patient is fully conscious, the temperature should be ranging from 46 to 52 degrees Celsius. Place the hot water bag on the patient's leg in an upright position.
Note, always check your patient's situation.
Monitor the patient as well as the time of application. Remove the heat bag after the designated period of time. Discard the gloves properly and perform hand hygiene. Procedure and the client's responses in the client record using forms or checklists that is supplemented by a narrative notes. Prepare materials.
Gloves, iced ice bag, tape, towel, waterproof pad.
Provide privacy by closing the door, window, or curtain. Greet and introduce yourself to the patient and explain the procedure.
For today. May I know your name?
Sarah Guevara,
May I know your age?
19,
May I know your birthday?
Feb 22, 2003.
Can I see your wristband? I will do cold compress. Is that okay with you?
Perform hand hygiene. Wear gloves to prevent the transfer of any microorganisms that might be present on the patient. Drape the patient and expose only the part that will be treated.
Position the client to comfortable position and pillow if necessary to support the part requiring the application.
Proceed in applying the hot compress by putting first the waterproof pad below the body part of the patient that is being treated.
Fill the ice bag with crushed ice about half full. Remove the excess air from the bag by bending or twisting the bag. Before you close it, hold the bag upside down to check if there are any leakage.
Hold the ice bag with a towel and secure it with a tape if necessary. Monitor the patient as well as the time of application.
Assess the patient in terms of comfort and skin reaction as frequently as necessary for the patient's safety. Remove the ice bag after the designated period of time. Discard the gloves properly and perform hand hygiene. Document the procedure.